Well, we're here with Dr. Kahng, a dentist in North Hollywood, California. Hi, Dr. Kahng, how are you?
I'm fine, how are you?
Good. Dr. Kahng, let me ask you a question here about your practice, about your dental practice. Different dentists have a different practice. Some they do only very, very cosmetic dentistry. Some do only children. Some do, they don't do dentures. Some do different types. They're basically different style of practice. Even though dentistry is dentistry, all you dentists operate a little different. Tell us a little bit, what is your clientele, your patients, what do they look for? What can you give them? What is the philosophy of your practice? And maybe, Dr. Kahng, maybe you tell us, how did you become a dentist?
Okay, I'm a general dentist.
Okay.
So usually I'm doing for the preventive dentistry or for the children or basic dental treatment. That's mostly I'm doing. Also I can do the prosthodontics, I can do the dentures or bridges or crown. Some patients, they have a pain, then we do the extraction or root canal treatment. So usually we cover up most type of the dentistry.
All right. So you see children, you see elder people where you do dentures, you do almost everything in the house. Did you say you're doing orthodontics and or Invisalign also?
We do orthodontics. Invisalign, we don't do that, but we do the regular orthodontics, we do that.
Okay. All right. Okay. Well, all right. Now, how did you become a dentist?
The reason I became a dentist was very funny thing. When I was little, actually I was elementary school. I went to my dentist. He wearing a very big watch. I like the watch. So I decided, I can be a dentist. I can wear that kind of watch. That's it was the first thing I want to become a dentist. But actually become a dentist was when I was in high school.
Yes.
Before I decided to go to the college, one of the teacher, he recommended me about the dentistry. Before that time, I didn't know not that much about the dentistry. But he went to dental school and he recommended about the dental school so much. So I decided, why not? It can be a good thing for me. So I decided to be a dentist.
Well, wonderful. What did this teacher in high school recommend about a dentist so much? What intrigued him? What did he tell you kids why you should be a dentist?
Actually, he needed some dental treatment, and somehow he went to the dental school for his dental treatment, and he had a very good experience over there. And after he come back to my classroom, he talking about his experience at the dental school, and he highly recommended me go to the dental school, be a dentist. I said, wow, that's a good idea. That's the reason I applied to the dental school that time, yes.
Right. Well, at the beginning of this, you said that you're a general dentist and you pay lots of attention on prevention. Is it true that in dentistry, almost all problems like teeth falling out or major periodontal disease, people needing dentures, even implants, and having, infection with the gums, that all that actually can be prevented if people regularly go to a dentist and let the dentist do the little fix-ups and touch-ups, what is needed. Is that really true that most of it is preventable?
Yeah, I believe that we cannot say 100%, but most majority of the dental problem can be prevented. Especially for the gum disease, and when patient they clean properly and visit the dentist regularly, most time can be prevented. Also the cavities, at the early stage of the cavities, it can be easily get fixed, or they can be prevented. So I highly recommend to all the patients, preventive is more important than actual treatment. So go to the dentist regularly, and brush your teeth, floss your teeth. That's I emphasize to the patients. So oral hygiene is very, very important. It's the most important part for the dentistry. Yeah.
And how do you feel? Many doctors these days, MDs, surgeons, and of course dentists, start realizing, and more only lately, the last few years, not 10, 20, 30 years, really only lately, and they start finding out that more and more illnesses such as kidney failure, liver, diabetes, premature born babies, headaches, back pain, neck pain, all kinds of things are linked to problems in the mouth. There are some dentists and some MDs out there, some surgeons who strongly believe that for all purpose, almost every problem somehow starts in the mouth. How exaggerated is such a statement?
I'm not sure about the part. I really don't know about the part that much. But most of those kind of the health problem can be related to dental problem, especially for some kind of gum disease. It's directly connected to the heart disease, and some kind of difficulty of the chewing food. Also, our general nutrition can have the problem. It can cause all kind of disease. Yeah, so some part, is connected. Yeah.
Right. And people having, their teeth misaligned and their hinges being crooked, the DMJ type of problem and stuff. They can have headaches and shoulder pains and all that stuff, right?
Of course, yes. TMJ, it causes so many different kind of problems too. Headache, backache, or the posture problem. But if they cannot sleep well, too much problem can cause. So all those TMJ problem can be from the missing tooth or malaligned tooth. So we really recommend those patients to go to the dentist and fix their teeth.
Right. And then, of course, if you look at it, if a person, for instance, you mentioned cannot sleep well, that in itself creates problems by the truckload. Not sleeping well is probably one of the biggest diseases a person can have to a very high degree because it triggers every other disease, including going insane. Well, all right, Doctor, thank you very much for telling us what you're all about. Appreciate that, and we're going to check into some more videos about some of those specialties and those problems which you talked about. Thank you very much.
Thank you very much.